while we're on the subject, let's just go to Dr. Kevin Kavanagh. Dr. K, good morning, sir.
Good morning, Jack.
It's a big day, you know.
Oh, I know. They're going to start the vaccines.
Tell us about it.
Well, the first shipment of Pfizer vaccines have arrived, and healthcare workers, I believe, are going to be the first recipients of this. And this is a big day because it really does mark a turning point in the pandemic. We're at least hitting back at the virus. It's going to take some time, some months for it to work down through the population and that everybody has the opportunity to get the vaccine. But if you can remember, Jack, we were thinking at the beginning of this pandemic, this would take 5 to 10 years to get here. So this is really a great triumph of both science and the administration.
Yeah, it really, truly is. And let's see, there are 2 or 3 different makers that are releasing vaccines at similar times. Am I right or am I mistaken?
Well, Moderna will be coming online probably in a week or so because they are going for FDA authorization this week. And I also think that
Pfizer now, the first one?
yeah, Pfizer is the first one, Pfizer BioNTech. Then Moderna will come on board. Johnson & Johnson appears to be fairly close, probably first of the year in January. And you also have AstraZeneca and Oxford. That vaccine should also be coming on once they get their clinical trials cleaned up.
Good. So what else is in coronavirus news and the whole subject this morning?
Well, the big thing that caught my eye is that 3 leopards at the Louisville Zoo, 3 snow leopards, got the coronavirus. They were wheezing and they were coughing. And this kind of surprised me because, Jack, I would think snow leopards were pretty good at enforcing social distancing. But they weren't wearing a mask, and this is why we say you have to do both, social distance plus mask. They also might have chose to eat indoors where the virus might have aerosolized. And of course, we can't rule out that it was on their food. Somebody might have coughed or sneezed on their food before they gave it to them. So I'm not really sure how they got it, but it is a surprise. This is now the 6th animal species that have gotten the virus. A lot of these are in the cat family. There's house cats, lions, snow leopards, tigers, and we also have dogs and minks that we know can harbor this virus. So it is very unlikely humans are going to get to herd immunity. We need to take the vaccine and we need to socially distance.
Well, that's an old tune, but I guess we just have to keep singing it.
Now, the other thing that is in the news is Germany. And Germany is closing down. They're going into a hard lockdown. They're closing down schools. And what I think we need to note is that the viral spread in Germany is not nearly as much as it is in the United States. In the United States, if you adjust by population and you look at the cases on Sunday, we probably have close to 1.4 times the amount of viral spread in the community. That's number of new cases. And 2.5 times the number of deaths. In Kentucky, we have about 2.5 times the number of cases. So when you talk about should we close down, should we go to school, you really need to take things into context. One of the things that really disturbs me is that there's a lot of spinning going on. For example, Dr. Fauci is commonly being quoted in the media, and I think misquoted, that he said you can open up schools. Well, what he said is that the default position is to open up schools. And you need to know what the word default means. That's a fancy way of saying is you can open up schools if there's not a reason to not open them up. In other words, if it's not dangerous, the default position is you open up schools. Well, of course. Yeah. So that's kind of a political way of saying, you open up schools when they're safe. If you talk to teachers, they'll tell you, we want to go back to school when it's safe. And we've talked about how to make schools safe. You look at the air circulation, air sanitization, have adequate masks, social distancing. You want to have the children set up in pods to do pool testing. All of this should be in place. And of course, there's a number of strategies and new protocols which have to be put in place so that you have proper environmental cleaning and you make sure that the parents are kept apart. when they come and they start to congregate in schools. You don't want congregation of any type happening. So all of this is, I think, new. And really, Jack, we are on the verge of getting out of this pandemic. We just need to hold in there until the vaccines arrive.
Dr. Kevin Kavanagh, thank you very much. We always enjoy talking to you.
Thank you, sir.